Welcome to Beyond the Silence, Beyond the Pain. Thank you for joining us again. And I want to just ask you, please, to remember to like, subscribe, and share. And tonight, we're going to be dealing with the topic, how do I protect my children in an abusive situation? For the last the last 2 weeks, we have done how to approach leaving an abusive relationship and abuse justification for divorce. So I hope you've been enjoying what we've been doing so far. We've done various topics from narcissism to any kind of form of abuse. What are the signs of abuse, which is one that was published on the 14th of October of April. And I hope you get a chance to watch that. That one, what we have done is that we have posted all of the signs that we could come up with. And we would want you to share that with anybody that you think is having issues with abuse. I have written a book called Blink Twice, and it's available on Amazon. That also has information that you can get that will help you or other persons who are having similar issues. So again, thank you again, Doc, for being a part of this. Dr. Allen, as I said, is very experienced. He's a retired psychiatrist. I, on the other hand, I am the one who had a bit of experience in this area. And so the two of us together, I believe, have managed to put together some valuable information. And so I would ask that you share, like, subscribe. So over to you, Doc. So the question tonight is, how do I protect my children in an abusive situation?
Yes. Well, it's important to recognize that in 2010, it was found that 1 in every 15 children in the USA were exposed to intimate partner violence. 1 in 15. While 1 in 3 were also experiencing acts of violence themselves. Right? Now, we must not assume that children who they say children must be not seen and they mustn't be heard. Seen and not heard, And we feel that they're stupid and they don't know what's going on and we don't talk about what's happening.
Mm-hmm.
And the wife might put on white what you call it, powder to cover the
bruises.
Yes, and of course the abusive partner might know how to abuse and the bruises are not seen. Yeah, and the other person can cover up. But the children are hearing what is happening. It's they're gone to bed. They are hearing the quarreling and the shouts and the verbal abuse.
That's it.
And they're hearing the noise and they're observing how people are acting, people being insultive and controlling, and people being tearful and fearful, and all these reactions that we have spoken about. They are observing it.
Indeed.
Right? And the other thing is that children like to feel that they need to be protected, right? And feeling unprotected in that situation, it can lead to several things.
Yes.
Now, it can lead to a state of perpetual anxiety. And I need to point out that there can be short-term effects and longer-term effects. Of course, the short-term effect can grow into the longer term.
Yes.
But let's think of what could be happening while the child is a child. So with this perpetual anxiety, you could have childhood anxiety showing itself as stomach sucking, bedwetting, crying a lot and whining, because of what they've been going through. Some children can feel guilty, or some children feel that somehow the mother or the father is an extension of themselves, especially and they can feel that if anything happens to the parent, that they are responsible. They have that magical thinking that
Yeah.
they must protect the parent, and if anything happens, they are responsible. And they can, sometimes even the way parents treat children, when the one person is hit and insulted, and they pass it on to the child. I saw an ad once, cartoon,
Yes.
where the man came home. He was at work, and the boss chewed out, quarreled with the man. So he came home and slammed the door and shouted at his wife. And then the wife shouted at the child, and the child went and kicked the dog.
Yes.
Everybody was displacing anger to the other person. And sometimes the child can get the butt of it, being passed down to them.
But the Bible, there's a passage in the Bible that says you should avoid an angry man, or you yourself would become angry.
Exactly.
Yeah.
Yes. You see. So children can get caught up in the whole thing with the loss of self-esteem, feelings of guilt, feelings of blame, and being the butt of anger from those above them in the home. Then there's post-traumatic stress disorder. And we know this can happen, for example, people who went to war and who are victims of war with all the shells and the noises and the people around them dying and they barely escaping. And so they keep reliving all these things, and they can become angry and violent themselves and fearful. But the children will relive, can have nightmares, and they can reliving the trauma,
Yes.
shouting and screaming in the night, and they also can relive the trauma and displace it. So they themselves can become irritable and angry and become bully at school, and sometimes they can even get involved in criminal behavior and so on.
Yes.
They are at risk because of going through this trauma. Of course, there can be physical injury to children who are abused. Sometimes because you don't tell nobody what happened in this home. You don't
Yes.
do that because you know what I'll do to you. But they themselves, sometimes they will come out and say, you can't lick mommy or you can't lick daddy. And then you say, okay, so you go and get it then.
That's it. Because
That
they
type
try to
of,
intervene. Yes.
exactly. So they
And they get
suffer.
caught in the
Yeah,
middle of
exactly. You see. So the thing is that we are saying that they learn now. They are learning abusive behavior,
yes.
which they can then carry out in terms of getting in trouble with the law, sometimes getting involved with drugs and alcohol as
Yes.
a way to ease the pain. Sometimes getting involved in bullying at school. So when you see a child at school acting out and being difficult and behavior problems, be sure to check that child and find out if there's any abuse in
Yes.
the home, right? And this, what we're sharing today, is for teachers,
Yes.
counselors, guidance counselors,
Yes.
Sunday school teachers, other parents in the community, and so on. Those who are around children to be able to watch for these things.
And as you said, I think even more importantly, for the parents, especially the victim, to understand that staying for the children's sake.
Not helping, not helping, not helping. You see, and sometimes the children are used as an excuse,
Exactly.
because they're afraid of leaving.
Exactly.
And they themselves feel guilty and that sort of thing. And
yeah, and sometimes the abuser uses that because they know that you're so attached to the children that there's no way you're going to want to break this up.
Exactly.
So they create that scenario, and I've seen cases where they manipulate the children to be so bonded to that person that the child doesn't want them to go, and it's all this emotional trauma. Oh
So
my.
the child becomes a scapegoat in the whole thing. It's like what you call triangulation, where there's a triangle involving both parents and the child. And the child is the one who can keep the children together, the
Keep the
parents
parents
together.
together.
But sometimes the child gets sick, and and when the child gets sick, they take them to the hospital together, and so on. And the child learns that if I can get sick and
then my
get
parents will be
show
together.
difficult behavior, that might keep my parents together.
Together. Oh
Yes.
my
So
goodness.
that is a very pathological thing.
Very sad.
So now there's such a thing known as adversive child experiences, ACEs. And children who suffer adversive experiences, such as we're saying, abuse, they're being abused themselves, or coming in between and seeing their parents becoming abused. And also, what they can do, before I come back to the ACEs, a child can feel that their parent has abandoned them, that,
Yes.
that they have failed them, because the parent is supposed to be the protector.
Mm-hmm.
And if a child sees a father or a mother who is the abusee,
Yes.
taking all the abuse and not protecting that child, they will feel like betrayed, and they
Oh,
will lose
wow.
respect for that parent.
Wow.
And then they could end up being abusing the parent of the
Somebody.
opposite gender, because they say, what are they? All right. So coming back to the ACEs now, one of the results of the adverse child experiences is depression.
Yes.
So they can grow up into adults who develop clinical depression, not sleeping properly, not eating properly, lack of energy, lack of concentration, lack of the ability to enjoy anything, you know, and just feeling that life doesn't have any use.
Yes.
Life is not enjoyable. And even suicidal feelings
That's it.
that can happen in that depression as well,
Mm-hmm.
hopelessness and so on. So there can be other health problems due to ACEs, such as being more vulnerable to heart disease, more vulnerable to being obese, more vulnerable to diabetes in adulthood, and related problems related to heart disease, obesity, and diabetes. And so these are some of the things that can happen. Um, and also repeating abusive patterns can happen in abused children, where that is all they see, that is all they know in
Yes.
terms of conflict management abuse,
Mm-hmm.
or resolving issues abuse. So they feel like this is it, this is the way, and then that is what they are going to do. So these are all the short term and long term problems.
Mm-hmm.
Now, how can we protect children? And well, before, I don't know if you want to add anything at this stage before.
Well, one of the things that I don't know if you mentioned it, I don't think you did, was the whole matter of that child, because I've had that experience where one of my children started to treat me the way how they saw their father treating me. And that is hard. I mean, I got to the point where I recognized that I had to put down my foot, because the point, I remember you mentioning it, and I remember my mother saying that to me as well, and it's something I would say to people. The first time that somebody does something like that, you need to stop them immediately. you know you need to put down your foot. You need to make sure that they're aware that you're not going to tolerate it at all. There's no negotiation, there's no questioning. There's just, that's really what I had to do. I think I stopped talking to that child for about a good 6 months. It's just like, I'm not going to tolerate this. I'm not going to tolerate it. And praise God, it doesn't happen anymore. But this is it. I mean, if it's normalized, if the child sees you accepting this as
That
normal
is it. That
behavior.
is it. Yes, because normalized.
Yeah.
So that is very important, that we cannot allow it. And I have known of situations where both the abuser parent and the child
Yes.
turn on the abusee parent, both of them at the same time.
Wow.
I've heard of that. They can
Wow.
get very, very bad. They get very, very bad.
Mm. Very
And of
sad.
course, Nobody else outside knows what is happening. Secrets.
No.
Yeah. You know, and if we talk about teachers, as we said earlier, teachers look out for the children who are
And the
acting
guidance
unusually.
counselors. Yeah.
Guidance counselor, Sunday school teacher, those in the
Yes.
children who are acting unusually, right? And of course, if there are adults, and in fact, one of the things I learned as a psychiatrist, that every adult who is coming to see you, and I'll say the same for counselors, don't be afraid to ask about who you abused as a child. Don't be afraid.
Mm.
Always find out about childhood abuse, because in many cases of adult problems,
Yes.
whether it be relationship problems or clinical problems, you're going to find that there's a history somewhere back there.
Wow.
Right, yes, you know.
But in the
So,
Jamaican setting though, Doc, I mean, if you call the way whole a lot of parents used to beat us. I mean, I mean, no, it's definitely referred to as abuse, you know. I mean, some of
that,
those,
that's an interesting thing, because remember we spoke about the scapegoating and the
yes,
passing on the abuse to the more vulnerable one. You know, what you call displacing anger.
yes.
Now, um, but there's a difference between corporal punishment done out of love and
Mm.
anger. So it is always said, you know, that you should not scold your child if
When
you are
you're
angry.
angry.
Tell them you're going to speak back to them, calm yourself, think it through, and then work out the best approach
Yes.
to have when you're dealing with your child.
Wow.
Mhm.
Yeah, but the Bible says spare the rod and spoil the child. So, you know,
Well, I mean, you know, the point is what has happened. I mean, I remember, I don't want to give personal examples, but there's a situation where I went to live with an aunt of mine, and I was playing, she was a teacher in the school, and I was playing with a child. And in playing, the child fell down and got a little injury and so on. It was my fault, it was accidental.
right.
But my aunt said to me, you know, she said to me, look, I don't want the parents to feel that you have a privilege,
Oh,
that you are privileged because
uh-huh.
you're your aunt is a teacher, right?
Right.
And she's saying that I'll have to discipline the child, but I'm going to have to discipline you as well.
Wow.
It was not, but she explained it to me,
Right.
and I understood where she
Yeah.
was coming from. And she wasn't angry, she just explained what she had to do. And I was able to, and what I remembered most of all is the fact that she explained it.
Yes. Yeah.
I remember an incident with my father where I took his umbrella to school and I didn't tell him. And when I came back, he said, look, you have done something wrong. If you can't tell me, I'm not going to punish you. But if you can't tell me, then I'll have to punish you. And I said, I took your umbrella. He said, okay, don't do it again. I remember that because, again, they explained it to me. They
Right.
dealt with the principle and
Yes.
not just come and lick everything out of you know. No. So, you know, and sometimes the parent may say, this hurts me more than it hurts you. But I'm just doing it for you to understand that you don't do these things, you know.
Yes. And
So if
I'm glad you said that because I remember there were some very irrational beatings that some of them were even incorrect. You know, it's like
exactly,
you
exactly.
you have
Yes,
not a chance to even have a conversation to explain
exactly.
what took
Yes.
place. You know,
You can't punish a child in anger and
I
discuss
mean,
it and warn them and so.
you break a glass and you know you get beaten for breaking.
Mm-mm, mm-mm, mm-mm.
Got the
Has to be
glass out of
different.
your hand.
Yes, it has
Yeah,
to be different. All right. So, so we have to make safety a priority in the home, and the child's safety has got to be a priority. And
definitely.
if one is in a relationship where that person is going to upset the safety of one's child, the child must take priority
Yes, indeed.
over attempting to have a relationship, which is going to put that child at risk. Child is the priority. But you're dealing with
Amen.
the future, a future life, future generations.
Yes.
child's welfare is a priority, right? The other thing is that we need to teach children about healthy relationships. Talk to them about how to resolve conflicts, how to resolve
Yes.
problems, because there was a podcast put out earlier on about the 4 C's of healthy relationships.
Yes, the
Can go back and look at
communication.
it, you know,
Mm-hmm.
choosing a right mate, all these things we need to spirit talk to them, our children, and in trying to help the children,
Yes,
then we can reflect now, am I really living how I'm teaching my children?
yes,
Boy, I need to do more about this to set a good example. And that can help us too, the
mm-hmm.
abusee, to make the necessary changes. So the priority of the children and their safety and need for them to be socialized and taught how to
Number
have
one.
healthy relationships. And the children must learn about boundaries too. What you don't do in a relationship.
Yes,
You don't shout, you don't scream, you don't insult, you don't show disrespect, you don't hit things that you don't do.
yes,
And therefore, if they are taught this, it must be lived out with the abusive person too. And the
mm,
children must be learned how to be autonomous, not to get into a relationship for security and allow your autonomy and your freedom to be compromised,
yes,
right? Um, so again, if you are trying to encourage autonomy and independence in children, then that will also help you to develop a healthy atmosphere and relationship for the betterment of and the safety of the children. It takes a village to raise a child. So again, we are saying parents in a community, if you are noticing something, involved. Teachers get involved. Sunday
mm-hmm.
school teachers get involved. Church worker get involved. Get involved. It takes a village to raise a child. So it's not just the parents, but it's the community as well.
Yes. What I found interesting, in this country where I am here, they have I was doing tutoring. I was tutoring a child online, and
Mm-hmm.
they actually had training sessions for me to learn how to even spot the signs
Mm-hmm. Mm-hmm.
online.
There you go. There you go.
I
So
found
that
that
training
so
is
interesting.
important.
Yes,
Training up to train teachers and other people who work with children.
yes. They call it
Yes,
safeguarding. Yes,
safeguarding.
yeah,
So I would throw that out as being very important as
yeah,
part of that village. Safeguarding training.
yes,
And again, the government departments that look after the safety and protection of children, they
yes,
must be on the ball and be willing to
definitely.
act and to intervene where there's any evidence
Right.
of children,
Abuse.
who are being abused. They must be on the ball as well.
Yep, yep, yep. Oh boy. I mean, the issue, and I think I mentioned it earlier, is that one would think that, you're protecting your child by staying in a relationship
Oh
because
yes.
you don't
Mm-hmm.
want them to have a single parent, a lot of times the mother or the father would have grown up in a single parent home, and they want to make
Mm-hmm.
sure that their child is in a home with two parents. But
Mm-hmm. Mm-hmm.
it's like you're being between the devil and the deep
The
blue
deep blue
sea.
sea.
And the
And some
question is,
children. Go ahead.
yeah, the question is which one is going to be better for the child? And I'm definitely agreeing that, the kinds of effects, the psychological effects that
Mm-hmm.
can be on
Mm-hmm.
these children if you stay. I believe that
Mm-hmm.
it is even worse because
Mm-hmm.
when you
Mm-hmm.
leave, at least you can find some people in the church, or family support. You find other
Mm-hmm.
ways to help you to raise this child, but to have to stay in an environment where you are being messed up, your mind is
Yes.
messed up, you can't even be a good parent because
Exactly. Exactly.
if you're not careful, you're constantly in depression. You're constantly in pain and not knowing what to do, and you're a basket case. You're not able to
Yes.
help the child in any case. So
So what we're saying then is that well, truance is another sign, when children run away from home or
yes,
they look out for abuse. But what we're saying then is that as we were speaking earlier in an earlier podcast about leaving safely
yeah,
and building up a network of people who can help us to leave safely. But also it's good to have a network of people who can help with the safety of the children.
yes,
And people who we may feel that, send the child to that person before we leave for our safety, for their
yes,
safety, and um, keep that network going so that a child is not going to be isolated at home
that's it.
along with the abusee.
Yeah,
To work against that. Uh-huh.
yeah. Well, I want to thank you again, Doc. Come to the end of another triplet. We've been doing these triplets, and the first of the triplets was how to approach leaving an abusive relationship. The second one was abuse justification for divorce. And we just completed how do I protect my children in an abusive situation. And so I hope that this content would have been beneficial to you as you listened, and that you would have been provided more wisdom, more education that can help others and can help yourself, even as we all try to maneuver, because as we said earlier, that this is much more prevalent than we think. It's happening every day, every moment, and it's something that we really need to be aware of and understand. So thank you again. I don't know if you have any last words you want to say.
Now, one thing I would say, if one's child comes to an abusee parent and says, "Mommy or Daddy, why are you taking all of this? You know, you need to help yourself. You need to do something." Don't attack the child and say, "What?" As if they're stupid and they don't know what's happening. And I've known of situations where sometimes the child was had to go to the therapist
Yes.
to discuss, and then the parent follow
My kids.
afterwards. Sometimes the child has to go and get help for themselves, and the parent follows.
Yeah.
So don't make the child sound stupid if they raise the issue with you.
Yes, indeed. Yeah, the children, I mean, they're children that have been brought into your life for purpose to help you.
Yes.
And we need to listen to them, we need to listen to them. So,
Yes.
yeah. So again, thank you, Doc. And have a great rest of the day, everybody. Thank you for watching, and remember to like, share, subscribe. Right? Have a great rest of your day. Bye.